Hi, Danielle. How are you today?
I'm doing good. How are you?
Good. Well, thanks for joining. Can you tell us a little bit about your practice and what you do here at Honigman?
Yeah. So I'm Danielle Bass, and I'm a partner in Honigman's corporate department. I focus my practice around technology transactions and spend most of my time helping people and companies with the buy, use, sale of intellectual property and information technology.
Okay. Yeah, and we work together a lot on telehealth contracts, so that's what we're going to talk about today. And I'm sure, as everyone knows, telehealth has completely exploded. Just a few days ago, the White House released a report that telehealth visits increased 4,000% over pre-pandemic visits and time. So you can see just from that number just what happened in telehealth and how quickly it expanded, and that it's undoubtedly here to stay, hopefully, for the long run. And I know we've both seen a significant increase in telehealth agreements and arrangements from clients. So when one of these contracts crosses your desk, I mean, what do you do first? What are you looking for?
Yeah. So first thing I do is map out a description of the services to make sure it accurately reflects the intended scope of the arrangement. We need to understand who is providing what and who is working with whom. Oftentimes, this is where we uncover third parties who need to provide ancillary services like connectivity or billing that have to be covered by the agreement. If there's any necessary integration or interoperability of electronic data generated from the telehealth services into electronic health records or health information exchanges, it's important to know that at the outset. If I'm representing an institution or clinician that's receiving the telemedicine services, I always inquire about how the patient will interact with the telemedicine system and when the patient relationship attaches. If those services are patient-facing, patients have to be informed of any risks in using the particular service, informed of their informed consent to receiving telemedicine consultations from a medical and a cybersecurity perspective, given notice of the privacy practices, and provided a reminder of their freedom to select any provider. It's also super important that any compensation pursuant to the system is clearly described. You know, what's the fee for the telemedicine services? What about maintenance, support, training, implementation? And then how are physicians going to be compensated for their services if the system is patient-facing?
Yeah. Well, that's where our practices really overlap, because I look at some of those same issues, but from a different perspective, as far as a regulatory perspective and fraud and abuse issues. So that's really interesting. Okay, so when you are reviewing one of these contracts, what do you spend most of your time reviewing and negotiating? Like, what are the big pieces?
Yeah, confidentiality and data security protocols are paramount in these arrangements. Any telemedicine agreement should require that the confidentiality, integrity, and security of protected health information is maintained. How parties determine to allocate risk with respect to privacy and security can really make or break a deal and might be the most imperative obligations in the event something goes wrong down the road. Obviously, HIPAA and high tech requires stringent privacy and security requirements, as well as other national standards for electronic healthcare transactions. But prudent recipients of telemedicine services will also ensure that their agreements cover state privacy and data breach laws. If payment processing is contemplated, for example, by the platform, we should be cognizant of PCI DSS security obligations as well. If there's a third party providing connectivity, oftentimes this impacts whether the vendor remains responsible for functionality and security, so that has to be thought about. I always ask my clients to identify where the patient information is being stored, who's going to be responsible for obtaining disclosure, and most importantly, who's responsible in the event of a security breach. When I'm counseling both providers and recipients of telemedicine services, I discuss how these obligations are intricately linked to indemnity obligations and whether insurance or limitation on liability is going to be sufficient in the event of a cybersecurity event.
Yeah. Well, that's great, because a lot of healthcare providers think only about HIPAA and a business associate agreement, and there's so much more to data protection that goes into these agreements, as well as other non-telehealth agreements. So a lot to think about there. All right, what's the last most contentious issue you see when you're negotiating these contracts?
So patients expect their healthcare providers to protect their health information. And when their providers provide them telemedicine, they expect that their health information is going to be secure and their privacy is going to be maintained. This, of course, is not always the case, and it's imperative that the underlying telemedicine contract contemplates what happens if things don't go as planned. A recipient of telemedicine services will always try to negotiate for the kitchen sink approach with super robust reps and warranties regarding guaranteed uptimes and limited downtimes and security features to meet HIPAA and other state security requirements. I'd advise recipients of telemedicine services to push for indemnity from the provider for any malpractice claims, HIPAA claims, fraud and abuse claims, commercial business claims, cybersecurity claims. But if I'm representing a provider, I always try to limit those claims to those that the provider specifically has control over the circumstances of, or where the provider has failed to implement reasonable industry standard measures or otherwise acted willfully. Provider of telemedicine services will also lean on the limitation of liability provision, which will also cap the amount and the type of damage available to the other party. These are easily the most heavily negotiated provisions in every telemedicine agreement. So it's super important to have trusted counsel in doing work here.
Yeah. Okay, well, this was great. Thanks for sharing your expertise. It's, a lot to think about here. So can you tell the listener how to reach you and your contact information?
Yeah, so I'm available on Honigman's website. My email is dbass@honigman.com. And if you want more information like this, you can follow Honigman's data security blog, The Matrix, on our website.
Okay, great. Well, thank you for joining.